A new study offers compelling evidence that choosing plant-based oils over butter may contribute to a longer and healthier life. The research, which followed over 221,000 adults for more than 3 decades, found that those who consumed higher amounts of butter faced an increased risk of premature death, while those who regularly used plant-based oils like olive and canola experienced a reduced risk. This highlights the significant role dietary fat choices play in overall health and longevity. Participants in the study, who had no prior history of major diseases such as heart disease, cancer, or diabetes, provided detailed dietary information every 4 years. Over time, a clear pattern emerged. Individuals who consumed the most butter, roughly 1 tablespoon per day, were 15% more likely to die prematurely compared to those who ate very little. In contrast, those who incorporated plant-based oils into their diets saw a 16% decrease in their risk of early death. The researchers accounted for factors such as age, body mass index, physical activity, smoking, and alcohol consumption, strengthening the validity of their findings. The differences between butter and plant-based oils primarily stem from their fat composition. Butter is high in saturated fat, which is known to raise LDL or bad cholesterol, a key risk factor for heart disease. Plant-based oils, on the other hand, contain unsaturated fats, which have been shown to improve cholesterol levels and help reduce inflammation in the body. Prior research has consistently linked monounsaturated and polyunsaturated fats with better cardiovascular health and lower risks of chronic diseases, making them a preferable alternative to butter. Interestingly, the study also found that the method of butter consumption played a role in its effects on longevity. The increased risk of premature death was most closely tied to butter used as a spread rather than in baking or frying. While the exact reasons for this distinction are unclear, it suggests that direct consumption may have a stronger influence on overall health compared to butter used in cooking. Not all plant-based oils provided equal benefits. The most protective effects were observed in those who consumed higher amounts of canola, soybean, and olive oils. These individuals typically consumed about 5 teaspoons per day, compared to 1 teaspoon among those with lower intake. In contrast, corn oil and safflower oil did not appear to have a significant impact on longevity, reinforcing the idea that not all oils are equally beneficial. Further analysis revealed that for every additional 10 grams, about 2 teaspoons, of plant-based oil consumed daily, there was an 11% lower risk of cancer-related deaths and a 6% lower risk of heart disease fatalities. Conversely, an additional 10 grams of butter per day was associated with a 12% higher risk of premature death from cancer, although it did not seem to affect heart disease mortality. These findings emphasize the importance of choosing the right types of fats to support long-term health. It is important to note that while this study establishes a strong association between butter consumption and increased mortality, it does not definitively prove causation. The reliance on self-reported dietary habits introduces some degree of human error, and the study's participant pool, primarily white healthcare workers, may limit its generalizability to other populations. Additionally, it is possible that individuals who consumed more plant-based oils followed healthier dietary patterns overall, further contributing to their increased longevity. Experts suggest that the way plant-based oils are incorporated into the diet matters. Using them in salad dressings, for roasting vegetables, or for sautéing lean proteins like poultry and seafood can maximize their health benefits. However, simply consuming more plant-based oils does not guarantee improved health if they come from ultra-processed foods like chips or baked goods. Moderation is key, as even healthy fats contribute to overall calorie intake, and excessive consumption can lead to weight gain. This research reinforces the importance of making informed dietary choices, particularly when it comes to fats. While butter may have a rich flavor and nostalgic appeal, its impact on long-term health cannot be ignored. Replacing it with healthier alternatives like olive or canola oil can provide lasting benefits, reducing the risk of chronic diseases and increasing longevity. By making small adjustments to daily eating habits, individuals can take meaningful steps toward a longer, healthier life.